Hi, I'm Dr. Samuel Passy. I'm a cornea and refractive surgeon at the Eye Institute of Utah. I grew up in Minnesota for half my life and grew up in a small house on a lake. And then later, around junior high, I moved to Utah. And then I grew up in Utah and went to medical school in Utah. And then I went out to Duke for residency in Minnesota for anterior segment fellowship, and then back to Utah. When I was in medical school, I was doing mouse eye research, and we were studying a drug where I was doing intraocular injections into mice eyes. And then one of my mentors said, you know that there's ophthalmologists that do eye surgery for a career. And then I shadowed one eye surgeon and saw one cataract surgery, and I was hooked. In my free time, I'm pretty busy outside of the office as well as inside of the office. Things that I like to do are things with my family. I've got a beautiful wife and 2 little kids, and we love to do all stuff outdoors in Utah. So we go fishing a ton, we go hiking a ton, and now the little ones are starting to mountain bike, so that's been just a blast. When a patient comes to the Eye Institute of Utah, I want them to leave having experienced some of the most compassionate care that they could imagine, and we'll work with them to kind of understand their disease process and hopefully help them understand the surgical techniques and that we're going to be used to help them get better vision. From my opinion, what really sets the Eye Institute of Utah apart from other practices is a combination of their top-notch support staff, our latest technology that we have to offer patients, and then just the level of expertise and skill in all the surgeons at the Eye Institute of Utah. The thing that's most amazing about the patient experience for me is so many of our patients come to us with something that's really affecting all of their daily activities, and they're not able to do the things that they used to like to do. And then we're able to see under a microscope and identify what problem, if it's cataract or cornea disease, and then most of the time we're able to offer a great surgical treatment that's able to really transform their lives for the better. I'm really excited about current ophthalmology just because of the level of precision that we have to offer so many of our patients with so many of our surgeries, whether it's LASIK or PRK or custom cataract surgery. But I'm also excited for the future of ophthalmology just because there's so much innovation that goes on within ophthalmology. And currently we have really good lenses for multifocal lenses, or sometimes called presbyopic lenses, but that's a point in ophthalmology that we're really progressing even further, and I'm really excited to see what lens technologies we have moving forward within the next 5 to 10 years.